Welcome back, ladies and gentlemen. Now we will continue our keynote speaker, our presentation on IJCHM 2024. And for the next presentation, we presenting you the presentation from Association Professor Dr. Vasudevan Ramachandran, and he is Director Center of Postgraduate and Internationalization, Faculty of Health Science at University College of MAIWP International, or UCMI, Kuala Lumpur, Malaysia, and his specialization in genetic epidemiology, meta-analysis, systematic review. And today, he will present us with the title of presentation, The Road Towards Precision Medicine, a Scenario in Malaysia and Indonesia. So give big applause to Associate Professor Dr. Vasudevan.
Okay, good afternoon, everyone. Yeah, all are quite sleepy, huh? Don't worry, I will not make it more. So first of all, I would like to thank you all, particularly UUI, for organizing this one, of course, jointly with UCMI as well. And I would like to thank Prof. Dr. Marniati, Rector of UUI, and then Honorable Dr. Muthiawati, Vice Rector, President Affairs and Alumni Division of UUI, and then Dr. Alfian Ibrahim, and of course our VC, Prof. Dr. Wan Muhammad Hazizi, and Prof. Dr. Nurul Alia, and then Dr. Aminuddin, and also the other colleagues from Universitas Islam Negeri Mataram, and also the other Prof. Dr. Aidi Fadil, Prof. Dr. Muhammad Saluddin, and Dr. Safroni. So all are welcome, and then today I'm here to present my topic on the road towards the precision medicine scenario in Malaysia and Indonesia. I stand here, boleh ya? Boleh nampak? Okay. So precision medicine, have you heard about that? Okay, very soon you will be learning about that, because in future it's going to change everything. Whoever is going to get any disease, you want to predict what kind of disease you may get, or you want to prevent, or you want to cure it, you know later on you don't need to take more medications. You just get the genetic profile of yours, and then you can take the treatment accordingly if you want to prevent it and if you want to cure it. Okay, so that's the thing. It's already been there, but frankly speaking, Malaysia and Indonesia is just in infant stage, still a long way to go. But it's already initiated by both countries, and a lot of organizations have been involved to organize and to implement the precision medicine for the better outcome for the many patients. Okay. So now we see about what is
recording in progress.
Precision medicine. From here, what you can see that is effective strategy for as I said, that is for the treatment purpose and also for better improvement, and also for to cure some kind of diseases, particularly oncology one, I mean the cancer one, and also hypertension, diabetes. So a lot of diseases are there. So we will see that one by one how it goes. And what is all about that? We need to get the genetic information of each and every patient. It's no need to be even a patient. It's individual person. Let's say, for example, you may think that you are healthy, but when you see all the factors, risk factors about your environmental risk factors, you can see even the cholesterol or any kind of environmental risk factors. Also, how about the lifestyle changes as well, and genetic information. So you may have some kind of genetic variations, and you are considered as a genetic susceptibility to develop some kind of diseases in future. Now you may think that you are healthy, but if you want to prevent it, and let's say you have some hereditary diseases, and you can go through all the genetic profile, and you can try to prevent by changing your lifestyle. Okay, and in case still you get all these kind of things, instead of taking a lot of medications, so what you do, based on your genetic profile, you can take the, not you, the physician will give the proper medication for the better treatment. Okay, in simple way, maybe I can try to explain. Let's say a person have the lung cancer, okay, any cancer, whatever. So the person is going and the physician is recommending that. Usually what they will do for the cancer treatment, I hope they give medications, and of course they go for the chemotherapy, right? In case, if the person having the genetic profile information, if the chemotherapy is not working properly, and what they will do is, based on the genetic profile, they see that what kind of drugs it will be response to the particular person. So let's say the drug A is not responding and drug B is not responding. They are not sure that they keep on changing the drug treatment. Because of that, you are losing the cost, and also you are taking the wrong treatment. So once the physician will get to know the genetic profile of the patient, what will happen? They may think that chemotherapy is not a good way of treatment. They go for the immunotherapy treatment. So just imagine that people are just taking for chemotherapy for few years, and when you do the genetic profile, when the physician will get to know all the information, they change the therapy to the immunotherapy one, and it will be response to the drug. Okay, and the person directly can take the right treatment, and they will, maybe the life expectancy will increase a little bit further, and also there is a chance of improvement in the lifestyle, right? So that's why we need the genetic profile information of each and every patient suffering with a few diseases. Okay, so that's the example I can provide it. Okay, then as I said that, you may ask that, is that only one gene is the cause of all the diseases? Do you know how many genes we have? It's more than 22,000 of genes we have. Okay, so I'm talking about only one gene. You may ask that, how is possible that only one gene is the cause of diseases? It can be multiple genes, right? There will be many genes involved. But some of the diseases, particularly for the cancer, the breast cancer, we can say that BRCA1, BRCA2 genes are the most responsible for development of the disease, right? So what you do is, in that one you can find out the mutation, and that is the only single gene variant. Variant is nothing but there are so many variations out there. We can say that it's a deletion, insertion polymorphism, or single nucleotide polymorphism. If you heard about that genetic one, most of them will be having that SNP. It's supposed to have the normal variation, normal genotype. That means the single nucleotide polymorphism will be expressing the proper protein. But suddenly, because of the genetic variation, it will alter everything and it will produce a different protein. Okay, so because of that, everything has been changed and you may under the risk of developing the disease. So that's the thing, the SNP is the most important one to find out that what are the variations of each and every person. Okay, so usually what they will do is, you can see here the patient, and then we will do the genomic test and big data analytics, and then targeted medicine, precision medicine. But you know that this is not the easiest way. For example, why should I want to know about all these kind of things? I just go to the physician, or just go to the pharmacy, just get the tablet and then go ahead. Why I want to spend a lot of money for this one? Of course, I can say that precision medicine is a very expensive one, but it is definitely you have the outcome compared to the other kind of treatments. So that's why. And moreover, you need a lot of information, not only the genetic profile. Of course, you need to have the electronic record, health record as well, and there are some kind of analysis need to be done, and then only the targeted medicine, the physician will be providing the particular medicine for the patient, and the final one, you can have the better treatment, and they will know that which drug is response to you, particularly to you. Yearly, it was called as a personalized medicine. Because personalized medicine, they may think that only for the particular person, of course, but we can say precision medicine is also for the population. Okay, so they will know that these kind of medicines can be given to the particular population based on the genetic profile of the individual person. There are so many kind of things. For example, you can see that some techniques can be used by the PCR. I think most of the methodology, do you heard about the PCR, right? Polymerase chain reaction. I hope if you know about the laboratory one, you should know about the PCR as well. There are so many techniques involved, and based on the techniques, what they're doing is the precision medicine technology is rapidly increasing a lot, because most of the pharmaceutical company, they are targeting these kind of things because they want to get the proper treatment, and of course it's a quite expensive one as well. And you can see that a lot of key players are there. Example, Illuminia, MTPI, Pfizer, all the IJCHM, all these companies are trying to come up with a lot of new kits to go ahead towards the precision medicine. And then you can see that biomarkers, usually what they are trying to do is they are going to get these kind of things based on the treatment selection, early detection, and diagnosis monitoring. So mostly they are spending a lot of money for the early detection, because that is a much better thing. Because always we say prevention is the best thing to before you get diagnosed with any kind of disease. So some of the causes of the individual variability. You may ask that, doctor, you think that only the gene is the cause? How about the other kind of causes? Of course, as I said that, there are so many causes out there, particularly the environmental risk factors. If the person is having the smoking, alcohol intake, or any kind of maybe BMI, and also the cholesterol. So all these things also considered as one of the causes for the disease, and it can be based on that, it may be change the responsibility of the individual drug as well. But apart from all these things, genetics is the one need to consider for giving the person, for giving the drug. You can see that why I said that genetics is always the missing puzzle to know that what kind of drugs to give it in response to the particular person. So we need to know about the genetic profile information. So as I say that here, you can see that SNP1, I told you that it will alter the protein. Just simply it will alter the protein because of the single nucleotide polymorphism. Okay, you can see that some of the persons are not response to the drug. You can see that if there is a person with no genetic variation, and the person with only single gene variation, and also with the person with the two variants, based on that, they can easily give the drugs. For the normal dose, you can see that a lot of drugs they are taking for the person without the genetic variation. But the person with the two variation, they are giving only you can see that it's a poor responder, because they have more variations as well. So this information is much needed as well based on the genetic variations. So nowadays what they're doing is, they are doing for the oncology, of course for the other diseases, mainly targeting the cardiovascular diseases. Okay, some examples. I think you heard about all these drugs. You can see that these kind of drugs they're using for targeting for the particular gene. You can see that CYP2, C19 gene, all these. You see that for the blood clotting. If the person having the blood clot, they may try to give different drugs. But if they have the genetic variant in this particular gene, and they may think that this is the particular drug will be response to the person. So that's why they are recommending to know that what kind of genetic variation involved in this gene. Okay, so currently what is going on, you can see that current medication, as I said that earlier, they just give the single drug to all the person, but they are not sure that who is response to this kind of drug. But in future, and also it's already started, I can say that personalized diagnosis, as I said that based on the genetic one, they can easily provide what kind of drugs to be given to the particular person based on the genetic profile. Okay, there are some kind of clinical flow. Of course, if you want to do again some kind of experiment, you have to follow a few protocol. We told that it's not is the easiest way to find out that what kind of drug can be given to the patient. So usually what they will do is they will try to get the blood samples from the patients, and also they try to visit regularly, and they will be checking all the parameters, clinical and biochemical parameters, and they will see that what kind of genes are involved. They will not simply study the genes. They have to know that what kind of disease you may get. That means you are already having based on the symptoms or based on the family history, like that. But if you already have the disease and you are not sure that what kind of drug you need to give it, then they will try to do this kind of information, and they will transfer everything into the profile, and then you can and then they will go ahead for the clinical validation, analytical validation, and then they will implement. So there are few kind of research methodologies you have to follow if you want to go ahead to do the pharmacogenetics. Pharmacogenetics is nothing but how a person, based on the genetic profile, responds to the drug. So if you're studying based on, if you're studying or if you're doing any research, then it's considered as a pharmacogenetics study field. So that will be very good because you are trying to get a particular population with any disease, and they are comparing with the controls without the disease, and they will see that whether the person having the genetic variation or not of the single gene or multiple gene as well, and then they will see that how you are responding to the drug. So they need to do some kind of analysis. Okay. And then, as I say that there are so many methods out there to detect the genetic variations, and you can see the most common is the sequencing one nowadays. Of course, next generation sequencing is quite expensive as well, and there are so many resources, outsources out there where you can give the samples to them, and they will give you all the analysis. It's not that every institute have, because it's very, very expensive. But instead of that, you can do the conventional one, the traditional one, like that PCR RFLP method. So even that is also need to be validated by using the Sanger sequencing. Okay, so in Malaysia, you can see that the population, and also I have mentioned about the life expectancy, and also compared to Indonesia also, of course, the population is very high in Indonesia compared to Malaysian one. Okay, so some of the key research, what is going on in Malaysia, as I said that, you can see some of the genetic variation. Most of the research is on the cardiovascular conditions such as diabetes, hypertension, and also with the other disease like oncology one. So notable organization in Malaysia, because as I said that, even though Malaysia and Indonesia are in the infant stage, but they already started a lot of things, and you can see some of the organization, they step forwarding towards the precision medicine. Like you can see Malaysian Genome Institute, it is in Kuala Lumpur, and they already started doing the genetic screening, and also the cancer immunotherapy and precision medicine also, they are doing it as well. All you need to do is you need to send the samples to them. Okay, another one is Genetic Regenerative Medicine Research Center. Also another one, Center for Bioinformatics Research, is in UKM as well. So these are the few notable organizations where they already started doing the experimental research for precision medicine. You may ask, how about in Indonesia? Do you know anyone what kind of research is going on? Pharmacogenetic research in Indonesia, who are all doing? Okay, I'll show you. Okay, when I was trying to do some kind of papers published based on the pharmacogenetics in Malaysia and Indonesia, then I found out that there are so many papers nowadays is going on in precision medicine with Malaysia. You can see that a number of publications started from, maybe am I not able to see, or you also not able to see? Can see? Okay, I can see some of the, starting from 2011, I think, and recently there are so many publications have been published in a reputed journal based on the precision medicine in Malaysia. How about in Indonesia? Of course, you can see that even though the numbers are not so great, but they are also doing some research based on the precision medicine. So don't think that Indonesia is very far behind the Malaysia, but they are they are already started doing the research on precision medicine as well, and published also. Okay, another one is Malaysia one. What they're doing is Malaysia Human Variome Project. They already started and they have come up with the Malaysian database only for Malay. And they have come up with so many genetic variations. These numbers represents the genetic variations of each and every ethnic of Malay. And they have already uploaded all the SNP databases in a particular database only for Malay. And whatever study you want to do, you can go there and you can download the data. So that will be easiest one. That is the first step. So they are already done in Malaysia. But of course, they need to do for the other ethnic races as well, for Chinese and Indians as well, because they have 3 dominant races. And of course, their strategic plan, they are trying to come up with the healthcare development by supporting the research and innovation. And they are trying to improve the economy as well, based on the precision medicine one. And another one, we have Malaysian Genome Institute, where they are playing a very important role in discovering, in analyzing the genomic research. And also, of course, they are doing the precision medicine as well. This is located in IJCHM near Bangui, also in Kuala Lumpur. Okay, another one, you can see that Prime is another one, is the precision medicine for diabetic individuals, a joint Malaysia and UK effort. This is also a very good organization where they are focusing only on diabetic patients. Even it's not only for the oncology patients with the cancer, also you can even do for the cardiovascular diseases. Mainly these people are focusing on the type 2 diabetes. Prime. How about in Indonesia? You can see here Samratulangi University. Mana ni? Manado. Right? Have you heard about this? Anyone? Indonesians? Manado? Is it there? Anyway, it's already been come out in the newspaper, and they already have 17 whole genome sequencing laboratories available in Indonesia. So don't think that they don't have the proper facilities. They already have a lot of facilities for doing the genome sequencing as well, and particularly in this place, they already started with this kind of network activities. So another one, genome sequencing and the future of precision medicine in Indonesia. So I said that recently in the Jakarta Post, they have come up saying that Deputy Health Minister, I'm not sure whether it's the current one or ex-one, maybe you may know about that. He already mentioned about that this is going to play an important role in the future medicine one. Of course, some webinars have been done in the University of Indonesia School of Medicine, RSCM FQAD. Somewhere they have collaborated with the Indonesian Clinical Training and Education. They already started doing a few kind of seminars, webinars, and also some research activities going on. And then, of course, another one, you can see that according to Dean Mahendra, he has mentioned that promoting the precision medicine are imperative, and you can see that they are also a little bit lagging because of very expensive one. But anyway, they are always they are trying to say that it can enhance the health status. So this is also is coming out in everywhere in Indonesia because they know the value of the precision medicine. That's why they invest a lot of money in this one, and they are started doing the research as well. Okay, another one is the pathogen. Have you heard about this pathogen in Indonesia? Okay, they are also started here. You can see that pathogen is already joint collaborated with the East Ventures and Royal Group Indonesia, and they are doing the early detection. And you can see that many researchers already started publishing the papers, research, such as from University of Sumatra. University of Sumatra, they already published some papers based on the precision medicine on cancer, and also BGSI, I think bioinformatic one. They already started and they already doing the sequencing live for precision medicine. You can see that they Indonesians, they already started. They want to do the sequencing for precision medicine, and you can give the samples to BGSI This is a very initiative one, and also the Nalo Genetics is another company. They already started developing for the risk of getting the risk of prediction test for many diseases as well. So there are so many activities also going on in Indonesia. They already started. They are moving towards the one to find out that for the better treatment for the patients. So you can do any kind of research with them, and you can collaborate, and you can also produce some kind of data. For example, you can collect a lot of samples from particular population, and you can do the genetic screening by looking all the genetic variations in single gene or even multiple gene, and you can collaborate with them as well. So it's going to improve. You're going to do everything for the patient's outcome, for the better treatment, for the better outcome as well. Okay, don't think that there is no conference. There are so many conferences already started, even in 2019, 2022. The precision medicine in KL as well, also in Indonesia. I think this was in 2022 as well. They already started discussing, all the research experts, they're giving their opinions on the precision medicine. And the particular thing is, in Kuala Lumpur, the Prudential, I think is worldwide, it's not only Kuala Lumpur, they already started giving the insurance for the people who are having the, who are trying to do the precision medicine test. So because it's very expensive, if I'm not mistaken, for the cancer therapy, for the chemotherapy or whatever, it will be more than 400,000 ringgit. So to reduce the cost, what you can do is, you can do the precision medicine, and you can give the samples to them, and they are ready to cover for the preventive one. Okay, here you can see some of the advantages, because I'm just telling about that. You can see that advantages of doing the precision medicine, of course, for the early detection and to prevent the disease and customize the medical treatment. Instead of taking a lot of drugs, you can focus on the particular drug which is response to you, and you can focus on those kind of things to get for the better outcome. And of course, you can reduce the adverse side effect as well, and then you can reduce the cost of the healthcare. That is the most important thing. We can always reduce the cost by selecting the proper treatment, and higher chance of recovery. Yeah, that is also good. And you can increase the life expectancy as well. There are also some disadvantages out there. You can see that it's not affordable, very expensive, because you need to do the sequencing for each and every gene. So that definitely is not a cost-effective one. It's quite expensive, and of course you may need a lot. You may need a lot of knowledge to understand it, and you need a genetic counseling as well. And they have to what do you call? You have to come up with some kind of clear picture to understand that what you're supposed to do as well. So this kind of also some disadvantages or that, but anyway, in each and everything there will be pros and cons. But always the better one is the advantages is one is for the area for the better outcome. There are some journals in Malaysia as well as in Indonesia. They are publishing the pharmaceutical healthcare one, also the precision medicine. Here you can see that Malaysian Journal of Pharmacy, they are frequently publishing the research articles related to the pharmaceutical care, also any kind of pharmaceutical research as well. And there is no article processing charge. You want to know, you can come for the next tomorrow section. I'll be giving more tips for to know about the journals, and also to know about how to write the effective scientific manuscript as well. So apart from Malaysian Journal of Pharmacy, you can see that Malaysian Journal of Medicine and Health Sciences, of course they are charging a little bit, 300 ringgit. And another one is International Journal of Pharmacy Practice. They are also welcoming all the research articles based on the pharmaceutical field. How about in Indonesia? Do you know any journal? Okay. You can see that Indonesian Journal of Pharmacy, that is also a very good journal, and they are welcoming all the research papers based on the pharmacology. So with that, I try to conclude that what I'm trying to say is definitely the precision medicine is one of the best effective strategy tool, or the treatment for predicting the early disease, also to try to get the proper outcome by knowing all the genetic profile information, and you can easily find out that which is the drug response to you, and you can take the proper treatment for the better outcome of your lifestyle or whatever. Okay, so right now, anybody wants to do the precision medicine to know that what kind of disease you may get or you want to prevent it? It's not only for us, it can be even done even with the person already have the disease as well, because they can take the proper treatment. Okay, so so with that, I just conclude my session as well. So precision medicine is not the old, it's not that it's a new one. It's already started, and of course we are marching towards the future one to get the, as I said, that is for the better outcome for the patients. So a lot of research activities are going on in both countries, and then a lot of papers also producing by the researchers as well. So definitely we have to go ahead to do some kind of research based on the precision medicine to get a lot of data. Okay, so with that I just conclude my session, and thank you very much. If you have any questions, you can email me or even you can ask me now. Is it okay?
Yeah, okay. For all the participants and audience, any question that you want to ask to Professor Vasudevan relate about his presentation, yeah. Yeah, especially for the medical student, pharmacy student, I think this is the important things, yeah, how to analyze and to make a right decision based on the condition of the patient in order to give the right medicine. Okay, any question from student here?
Ini ada satu.
Ya, ada mungkin? Okay, please.
So sorry, Doctor. My name is Muhammad Shafiq bin Muhammad Sharudin. I'm kind of interested with your statement regarding this precision medicine may reduce the risk of being having mistreatment or having to the trial and error phase, right? So if the method that we are currently using, which is we are using those medicine that are we formulate based on the majority with patronized. We also have the risk of getting like we come to some hospital and then they give us different some medicine, but when we come to another hospital they also give us another medicine, which is can be called as in differential in treatment. For the precision medicine, is that kind of risk is there a chance for that kind of risk happening?
I understand the thing is, for example, you are taking a treatment in a particular hospital, for example, for diabetes, maybe you are from Kelantan or anywhere or any part, and in that particular hospital, they are taking the treatment. Suddenly, you move to the another hospital in another state or any other place, they are giving a different treatment, right? And it may work or it may not work. And because the problem is, in Malaysia or even in Southeast Asian countries, what's the problem is, we don't have the electronic health record. We are just initiated already. It's going to be come up in another 10 to 15 years. That means with that single electronic health record, you can go to any part of the country and you can give what kind of treatment, what kind of drugs, everything has been taken. It will be transferred to the another physician by a digital one. So when it comes the one, they will follow the proper one. Then it will minimize the cost of the treatment, also the time, also the consumption, you can reduce it as well. So for this one, definitely we need the digital health record of each and every individual person to get the proper treatment. And for the precision medicine, the genetic profile is not going to change it. Okay, that is your genetic profile. So with that one, you can go anywhere, any part of the world, and you can deal with the physician, and you can say that this is my genetic profile. Please check that what kind of drug it will be based to me, and that one you can straight away you can get the treatment. Okay, so two things definitely we need it: a digital health record of each and every individual person. Also, the genetic profile will be valuable, validated, and is valuable for anywhere in the world. Yeah, thank you very much.
Okay. very straightforward answer for the question. And okay, maybe one more question. Any from the UI student? Okay, basically this is from pharmacy department.
For them, it's still a long way to go to understand, right? Anyway. Okay, so if there is no question, then I will end up my section. One more. Yes,
One more question, one last question.
Yes.
Bismillahirrahmanirrahim. Okay. First and foremost, thank you for your very clear and great presentation. As you mentioned before, that this method can extend life expectancy, right?
Yes.
Okay. So what are the consequences of this method, and what are the most suitable age for people that want to use this kind of method?
The earlier is much better. Because nowadays that even after a child is born, if you get the genetic profile information of a particular child, then you will get to know the future. What are the risks you are going to develop in the in future. So it's not that based on the age. It's based on it can be applicable to any person, any age range. And of course, what you can do is if the person already been detected, the disease also can be done. Because as I said that you are not sure that what treatment have to be given, right? Because always the doctors, they are also not sure because they don't know about the genetic profile. This based on your how it responds to the drug, they are giving the drugs, right? So in case that they know the particular profile, what kind of drug treatment can be given to this person based on the profile, they can also give it. There is no age range. You can do it at any time. But as I said that only the disadvantage is it's quite expensive nowadays. Okay. But even now they have tried to reduce the cost of the by using the next generation sequencing. Okay. So that one is a little bit cost, but you just imagine in future. But sometimes you cannot think that I'm going to get this disease in future. Is it? You may have some kind of psychiatric issues, right, as well, right? So that's why they don't want to know that what kind of disease I may get in future. But some people, they will try to prevent it because they know that under the risk of developing some disease, because their family, they may have that family history as well. So for them, they can do these kind of tests, and they try to prevent it by changing their lifestyle. Okay, if they get it, they will easily know that what kind of treatment they had to take. So that's the thing. Yeah. Thank you.
All right, thank you very much. Once again, give big applause to Associate Professor Dr. Vasudevan Ramachandran with very good and excellent presentation about the road towards precision medicine, a scenario in Malaysia and Indonesia. Okay, thank you very much for your presentation. Okay, maybe we still in session, or maybe in the participant or the student. Okay, we recheck again to the next presentation from Professor Dr. Muhammad Salahuddin, MSJ. He's already joined in Zoom meeting. Not yet. Okay, while we were waiting for the announcement, who is the best paper, best presentation, and maybe you guys still have question? Yeah, maybe from previous presentation for our 4 speaker for today. Yeah. Okay, ya mungkin ada ini pertanyaan-pertanyaan dari presentasi sebelumnya from previously presentation. Oke. Baiklah kalau begitu kita break sebentar. We have take a break maybe for 10 minutes for our judges to make decision, and we will make announcement about who is the best paper, best presentation, best presenter, and we'll be right back in the next 10 minutes. Okay.
aplikasi GoPay selalu ada harga murah. Download dah.
warahmatullahi wabarakatuh. We're so sorry for waiting for you. Now, me on behalf of the judges for today, we will announcing for the best oral presentation, best virtual oral presentation in scope of health and management. Okay, here we go for the first category, best oral presentation in health. Congratulations to Periskila Dina Kalikula. Okay, with title paper, antibacterial activity test of ethanol extract from barley leaf against the group of Propionbacterium acnes. Okay. For the next category, congratulations for best oral presentation in management, Desita Ria Yusian TB, with the title Optimization of Augmented Reality-Based Halal Identification Media as an effort to promote growth and development of the Syariah economic in Aceh. Okay, for the next category, congratulations for best virtual oral presentation in health. Congratulations to Maizatul Azmariza with the title Analysis of ID Polysomorphism of H gene among COVID-19 recurrent subjects in Malaysia. For the next, congratulations to best virtual oral presentation in management. Congratulations to Irwan Sukma bin Sukarman with the title Management of Occupation Safety and Health Using Information Technology in Tahfiz Center around Klang Valley Module Analysis. Okay, for the next category, congratulations for best virtual e-poster presentation in health. Congratulations to TSRD ID Fitrina Khairuddin with the title Mapping Research Trend in Oral Health Related Quality of Life in Prudential Disease Bibliometrics Analysis. Okay, for the last one, congratulations for best virtual oral presentation in management, Umi Kalsum with the title The Influence of Sharia Principle and Profit Sharing on Decision to Become a Sharia Bank. Okay, ladies and gentlemen, before we officially close the ceremony for today on IJCHM 2024 between UI and UCMI, we will closing with the doa. So we will recite by Irwan.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asrafil anbiya'i wal mursalin. وعلى آله وصحبه أجمعين. اللهم صل على سيدنا محمد وعلى آله وصحبه وسلم. اللهم إنا نسألك السلامة في الدين وعافية في العلم وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت. اللهم حون علينا في شكرة الموت والنجاة من النار والعفو عند الحساب. اللهم أحسن عاقبتنا يا الله في الأمور كلها وعجرنا من خزي الدنيا وعذاب الآخرة. اللهم اغفر لنا ذنوبنا ولوالدينا وارحم وارحمهما كما ربيانا صغيرا ولجميع المسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات برحمتك يا أرحم الراحمين اللهم ادفع عنا الخلاء والوباء والطاعون والفحشاء والمنكر والسيوف المختلفة والشدائد ومحانا جحارا ومن بلدنا هذا كنفش أبديا إندونيسيا يا الله برحمتك يا أرحم الراحمين اللهم استجب دعانا يا الله فاشفر مرضانا وارحم أمواتنا وهب لنا من لدنك رحمة إنك أنت التواب الرحيم ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين السلام عليكم ورحمة الله وبركاته
Very much, Irwan, for closing dua for today. And finally, before we officially close for our ceremony and conference for today, and the last and but not least, once again, I would say to thank you very much to our keynote speakers, to our special guests from UCMI, and also big thanks and appreciate for all of the participants who already joined in virtual Zoom. Okay, but today, before we closing the ceremony for this event, and we would like to invite all of you to take a group photo, before official we close for today. So, ladies and gentlemen, me as the master ceremony, on behalf of all the committee, would like to say thank you very much for all of the participants once again. Keynote speaker for do the best in order to successful this conference. See you next event, insyaAllah. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Okay, we will make the group photo semuanya kita.